Hey, I'm Unit Vet. We're doing our educational lesson today. I'm Dr. Stott. I've been here at the clinic working since June. So if you haven't met me, you'll have to stop by and ask for an appointment with me and we can get to know each other. Otherwise, we're doing these educational things to help us with some of our clinic mission statements. The first one being to bless people's lives by the way we take care of their animals through the medicine that we provide. And then also by doing excellent education. So as far as our mission statement as a clinic, that's kind of what we're hoping to accomplish with these. So today we're going to be talking primarily about cows, more or less preparing for our springtime visits and our appointments, as well as how to feed our cows over the winter. So here at Uinta Veterinary Services, there's two main services that we provide with our springtime visits, or really our all-year visits, and those are primarily our bull breeding soundness exams. So we want to make sure the bulls are good. They're going to take care of your herd, get everyone pregnant that we're trying to. And then the other big one that we're doing right now is our pregnancy diagnosis, and that's either with our rectal palpation going into the cow or with an ultrasound. So at this time of the year, we've done the bulk of our bull breeding soundness exams. Right now our goal is to have most of our cows pregnant. So at this point we're not going to do a lot of that, but coming up in the spring and the summer months, we just want to keep that in everyone's mind. Something that we want to watch out for, get on our schedule, so that we can plan for those. There's nothing worse than having a bull out with your cows for the season and having no pregnancies come back. So with that, we're going to check your bulls, make sure their semen's good, but we're also going to check them overall, make sure their feet are okay so they can walk up to the cows and they can mount appropriately. We want to make sure that they're not so heavy that if they do mount that they have issues that way. But we're also going to check their eyes, make sure they can see, and if they're out in a pasture, they can take care of the herd that way. The big thing that we're doing right now is our pregnancy diagnosing. Like I said, most people, their goal is to have their cows pregnant right now. And for the springtime calvers, that's kind of where we're at. So when you come in for your visits with us, we do have these facilities here. This here is capable to load up with semi-trailers. We don't have very many producers that bring in semi-loads of cows at one time, but if needed, we do have the capabilities there. And then next door is where we're going to load up all of our trailers. So if you want to bring one or two in at a time, so that's how we're going to monitor and evaluate your animals here. But we also do offer farm calls where we will come to you and we can see your whole herd. Sometimes that's easier than bringing 300 head of cattle in. With our cows and with our checks and everything, you're going to hear a lot of different goals that people have. You're going to hear some from your boss, from other veterinarians, from other producers. You're going to read stuff on Google. And every family has their own goals that they want. But some standard goals that I was taught when I was in school is that for our heifers, so either first or second time heifers, our initial goal is to have them calving at 24 months of age. And so what that means is we need to have them conceive around 13 to 15 months of age, so that they can carry that pregnancy and they can calve by the time they are 2 years old. With our heifers, we also want to see about a 90% conception rate after the first cycle. So as we're preparing our herds and looking for replacements, that is a goal that we want to look at to try to get 90% of the herd pregnant after that first service with either the AI or when we put the bull out. With our cows, similar goals. We want a cow to cycle and to calve every 12 months. So something that we need to see there is we're going to drop a calf, and then about 100 days later, when we start cycling again, we need to catch and get bred back. So that exactly a year later, the goal is to have that next calf be born. With our cows, our goal is a little bit less strict than with our heifers. We want about 67 to 70% of our cows to catch pregnancy on their first cycle. And then the remaining of them will catch on the second and the third cycle. But again, our overall goal of getting them bred again within that 100 days, we need to catch them pretty quick. And then we also want 95% pregnancy rate. So everyone that does get bred, we want at least 95% of them to be pregnant, and 9 months later have 85% of them calve out a healthy calf. And we want no more than 2% calf loss. So that's kind of is put together by my school, some of the reproductive specialists out there. Those are some goals that they've put together that we can incorporate with your farm however you see fit. So with these goals, data collection, this is where we as your veterinarians are going to help you out. Our goal is to provide that excellent service to you by providing that good medicine, but also that good communication, and just different ways that we can help you improve your individual herd. So as we come to visit you, or as you come to visit us, we're going to help you identify what you're doing really well, things that we don't want you to stop at all, and then we're going to look at things that could be improved upon, and we're going to make kind of a battle plan of how we're going to help you there. And then overall, we're just going to have a healthier, happier herd, and your production is going to thrive. So kind of focusing now on the pregnancy diagnosing, we're going to keep track of which cows are pregnant. We're going to keep track if they're how old they are. We want to keep track of how big they are, so their body condition score. And so every time I stick my arm in there, and if I call a cow pregnant or open, those are some things we're going to monitor, as well as not just how far along they are, but how big they are, how old they are. And that's some data that we're going to compile later that we can help you with your herd. So these three factors is going to help you understand if you're feeding well, if you're not feeding enough. If you have a bunch of big cows and they're all open, then we might need to cut back a little bit on the nutrition. Same thing if they're too small and your opens are more than we'd like. That's something we need to discuss to help get them to a better body condition score. On that information that we provide you might seem like a lot, but again, that's what we're here for. We'll help you understand it. It's data that we put together, so we know what we're trying to say. So just ask us questions and we'll help you there. So more than just the breeding, the body condition score of your animals, this data is going to help us know if your cows are settling on the first cycle, the second cycle, the third cycle. And right now that might not seem like a big deal, but if you have a bull that you just put out with your animals all summer long, they're out there for 3 months, it's good to know if you have them all catching early on, in the middle, or on that last cycle, as far as keeping track of who you want to keep for your continuing herd and who you might want to get rid of. So additionally to looking at those, we're going to look at which cows are conceiving on their first, second, and their third cycle. That's going to help you as a producer know which of these animals are going to be better kept to keep as replacements or to just keep in the herd. I mean, if most of your herd is not catching till that third service, you're going to be spending a lot more time and a lot more money taking care of them with food and everything. But if we can get more of them to conceive on that first cycle, then that's going to help them out. Additionally, keeping track of these numbers, if we have a bunch of cows come back that are 5 months pregnant, 4 months pregnant, and the bull's been out there with them for the last 5 months, and there's a bunch of open cows, we can kind of know if we have early pregnancy loss. Similarly, if the bull's been out for 5 months and we have 2 months, 3 months pregnant, but nothing 4 and 5, then we know that we're losing our pregnancies late in the cycle. And so having that information, that data, allows us to kind of look in and know where to start looking to see why we're having that loss of pregnancy. So right now, we got a lot of information for you, but as we work with you and your animals, especially year after year after year, we're going to see which cows are conceiving well, we're going to see which ones are open more often than not, and that information is going to help you to increase your herd, to have a healthier, stronger herd. So just some quick facts. As many of you know, gestation for our bovine breeds is about 9 months, averaging 273 to 292 days in most of our Bos Taurus breeds. So with the exception of twins, that's pretty accurate. Anytime we have twins, we're going to expect to see parturition about two weeks earlier. So this fact of 9 months is something we need to take into account. Do I want to start breeding now? Do I want to wait another month? As far as when do we want to start calving? So when we're deciding when we want to bring in the bull or when we start AIing, those are some important dates. If you could write those down for us when you come in, we'll ask you how long has the bull been with them, when did the bull first get out there. That's just going to help us as we're palpating know kind of more what to expect as far as, are we shooting more for 5 months with the bull, or has the bull only been out for 3 months? That's just going to help us give you more accurate information, especially with AIing. Anytime you AI the cows, if you just let us know the dates, that's going to help us know if they caught or if they didn't. Another benefit of our pregnancy diagnosing is we're going to have a really good estimate of when the calf is supposed to come, when mom should calve. So this is more important with our productions where the bull is just out there with the herd consistently, maybe 3, 4, 5 months. because at that time, if some of them catch on that first, then they're going to be 5 months along. Then that next cycle, a month later, they're going to be maybe 4 months pregnant, 3 months pregnant. And for you as a producer, you want to prepare as well as you can for parturition to know how to best help your livestock. So when we come, if we get a bunch of cows, maybe we do 100 of them, and if there's 50 of them that are 5 months along, and say there's 20 of them that are 4 months and 30 that are 3 months along, you know that in 4 months you need to prepare for about 50 calves to be born. In 5 months we're going to expect another 30 and so forth. Just so you can be prepared with your facilities, if you need to get hired hands to help you take care of the calves, or even just keeping an eye on them if you separate them into pens. Having that data for how far along they are is going to help you as a producer at the time of parturition. For most of our pregnancy diagnosing, we don't want to be too early. We do have some very skilled vets here that can catch early bred pregnancies, but anything 3 months or greater is going to be our most accurate as far as diagnosing pregnancy. I have this little show and tell. I don't have a horse like Dr. Gamble did, but there's just these different criteria that we can look at for diagnosing pregnancy in the cows. So some of the different things we look for is not just looking for a fetus, it's not just looking for a singular sign of pregnancy, but as we go and we pregnancy diagnose, we really want to make sure that your cows are pregnant. So we look for at least 2 signs of pregnancy, whether that's the fremitus that we feel in the uterine artery, if we feel the cotyledons or the plasmatones, if we feel a calf. We just want to make sure that they actually are pregnant and that they are still carrying it. So those are some things, and generally, like I said, about 3 months and older is going to be our most accurate, though we do have some skilled doctors that can catch them even sooner than that. Multiple benefits of gathering data and working with each other, but for now we're going to move on from that. And our second topic today is kind of cold weather nutrition. Here at Uinta Vet, I haven't worked specifically with a lot of producers with nutrition. Some of the other doctors have had more opportunities to work and just kind of break down the details of what we're feeding our animals. But there are some key concepts that we want you to understand as a producer. A lot of these are pretty self-explanatory, but just going through the list, poor nutrition is going to affect our reproduction. We're going to see delayed puberty in our heifers. So our goal was to have the first calf born at 24 months of age. So if we're not hitting puberty till 14, 15, 16 months of age, then we're going to start looking at our calving being at 25, 26, 27 months of age. So we need that nutrition to be up so we can hit puberty on time. And we're going to have abnormal cycling. So instead of the normal 21-day cycle, some of them go longer, some of them go shorter. We're going to have increased pregnancy loss. We're going to have increased dystocia, and then post-parturition care. For the calves, moms aren't going to have as good a colostrum or milk production. So those are all things that are going to affect our reproduction, our production as we go as far as nutrition. Luckily, here in Roosevelt, we're primarily beef cattle. We have a couple dairies that we service. With our dairy cows, we have to worry about the DCAD diets because at some points we need the negative DCAD, sometimes we don't. And then we need to consider nutrition for pregnancy, parturition, but then also with lactation. We're going to be hitting those peak lactation times that we really need to have our nutrition on par. But with our beef cattle, it's more so just taking care of them during pregnancy up to parturition, and then getting them back into condition for conception. So with most of our cows and heifers, our aim for conception, we want their body condition to be between 4.5 to 5.5 out of 9. There's been many studies done, but that's kind of the consensus that I'm finding, is having that kind of average body condition score at time of conception. It's going to help our cows catch better. If they're too fat or if they're too thin, we're going to have that reproductive issues. And then as they're pregnant, we want them to gain weight. Most of them we want to be around a 6 out of 9. Some studies do suggest being larger than a 6 out of 9. But for now, our goal for nutrition is to be about a 6 out of 9 at time of parturition. That's going to allow mom to take care of the calf. It's going to allow for proper colostrum and proper lactation. And then after parturition, just as we prepare back, we don't want to drop our body condition score too quick. But if we can drop back down to that 4 out of 5 to 5 out of 5, that's going to help us with catching our next cycle. There are some specific nutritions that we need to keep in mind. A lot of us feed the hay over the winter. There's a lot of snow here or the cold weather. So we need to keep in mind, on top of the hay, we also need to have copper, selenium, zinc, and then our vitamins A, D, and E. Deficiencies in any of those are going to increase our risk of pregnancy loss. It's also going to increase our anestrus period after parturition, and that's just going to increase our breed back time. So all in all, there's a lot of information. We don't want to keep you too long on these education minutes, but if there's anything else that you want to discuss, any other topics in this, like I said, we could talk all day and we would just be skimming the surface. If there's anything that we haven't really looked into, all four of us doctors here are willing to look into it. We love learning, we love taking care of animals. So if you have any interest outside of the scope of what we generally offer, just talk with us. And we might take some time to research it, but we do love learning. We want to help you take care of your animals. Feel free to contact us. Either you can come and visit us. Like I said, we have our semi-chute and our normal trailer drop out for our corrals. But we can also visit your production. Just call us at 435-722-9066. We can get you on the schedule to go and start collecting that data for your herd, or to help you learn how we can better help you in your production. And that data that we're going to collect, like I said, we're going to look at your bulls. We're going to check to make sure that they're sound, that they can breed your cows. We're going to do our pregnancy diagnosis, looking at age, looking at length of gestation and everything, to help us know which cows are doing really well and which ones we could improve upon. And then just overall looking at the herd to know how to help them. Thank you for your time, and feel free to reach out. All four of us vets enjoy working here. We love what we do and we love learning. So like I said, if there's anything you want to talk about with cows that's maybe out of the norm, just let us know and we'll take the time there. Otherwise, we are going to do some small animal talk next month. Dr. Tomeno is going to be talking about pancreatitis in dogs primarily. So make sure to join us for that next